Well, for months, we've been talking about COVID boosters, and people are wondering if and when they're going to need one.
In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker has an update on the process.
On Friday, the FDA made the determination that the risk-benefit ratio was not in favor of boosters for the general public, but decided in favor for those over 65 or at high risk. Right now, the CDC is meeting too.
To review all that data again and make the determination, we're assuming at this point, of what constitutes high risk and who specifically will be eligible for a booster shot.
About a month ago, a third shot was made available to those who were immunocompromised, but that actually was a third shot in the first vaccine series for those people to mount an adequate immune response.
Those individuals now will get 3 shots as part of their primary series at day 0, and then day 21 or 28, depending on what shot they get. 28 days after that second shot, they're eligible for a third shot of their primary series.
Johnson & Johnson says one dose of their vaccine is 72% effective, and a booster given 2 months after the first raises that to 94%. But if it's given 6 months after the first shot, the effectiveness against severe symptoms goes as high as 100%. But remember, when it's time for a booster, you need to make sure you stick to the same shot you got with your original vaccine series.
If you look at Pfizer and Moderna data, the immune response after a third shot for any individual is really, really strong.
But what many want to know is how often might we need to get a shot if this disease sticks around in one form or another.
It's not clear whether or not this will be eventually a 2-shot with a booster series or whether there'll be multiple boosters in the future. We don't really know the answer to that question yet.
Dr. O'Malley says for those who have breakthrough infections, they should talk to their doctor about monoclonal antibody therapy, whether they are vaccinated or not, because that can help mount an immune response too. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find more stories at wearthegown.com.